The good physician treats the disease. The great physician treats the patient who has the disease. This quote highlights the importance of teamwork in healthcare. While treating a patient requires more than just a surgeon, it requires an entire team of professionals. The registered nurse first assistant, RNFA, ensures a safe and successful surgery. Their presence significantly improves patient outcomes, ensuring efficiency, safety, and surgical precision. If prevention was the only cure, would surgery still be an option? And can surgeons perform miracles without a team? Are nurses really the heart of healthcare? Hello, I'm Whitney, studying registered nurse first assistant, and I have research sources such as Julia's article, Experience with Registered Nurse First Assistant versus General Practitioner Surgical Assistants, and McMaster Health Forum's article, Role and Impacts of Perioperative Surgical Team Assistants, to deliver the most accurate information using these sources and have many more. I will bring you the most up to date information. What are the essential reasons for grasping the responsibilities of an RNFA? The continuous rise of surgical treatment needs creates an equal requirement for professional surgical assistants. The RNFA enhances operational effectiveness and medical safety measures, improving patient health care. When we grasp what RNFAs are responsible for, it becomes clear how they enhance modern medical practices. So today, I would like to elaborate with you the role of the RN First Assistant. We will begin by analyzing the importance of surgical assistants and why they are important in operating rooms. The next section will focus on the medical equipment RNFAs need to fulfill their professional responsibilities. And finally, we will end the speech by evaluating the training and demand of RNFA professionals and how recruiting opportunities are developing for the nursing profession. We will begin by analyzing the importance of surgical assistants and why they are important in operation rooms. A surgical procedure requires multiple expert professionals to collaborate to achieve successful outcomes. And during surgical procedures, the RNFA maintains a significant position as a supporting partner to the surgeon. As part of surgical support, the RNFA handles instruments, controls bleeding, and performs incision sutures, thus permitting the surgeon to maintain critical operational focus. RNFAs protect patient safety by continuously monitoring surgery patients as secondary surgical observers. They maintain operational safety while the procedure continues smoothly. Hospital patients operated by surgical teams with RNFAs experience faster procedures and enhanced clinical results, as reported in the journal by McMaster Health Forum in 2024. The surgeon's needs become more predictable because of the anticipatory skills of RNFAs. And with that, moving on to the next phase, we will investigate the equipment RNFA specialists utilize. The practice of an RNFA requires specific surgical instruments that serve to support medical procedures. RNFAs must master medical tools because their skills result in surgical success. Registered nurse fellows use scalpels, forceps, retractors, and surgical instruments to support the operating surgeon during procedures. And correct handling procedures apply to these surgical tools and are necessary to establish sterile conditions during patient care. Surgeons depend on hemostatic devices to control bleeding since this operation step is vital for the patient's stability. RNFAs use electrocautery devices and hemostats to help to stop excessive bleeding and keep patients stable. So they say, why does the surgeon bring a red marker to the operating room? To draw a line at the excessive bleeding. RNFAs close wounds up using sutures, staples, and wound adhesive materials. The exact placement of these instruments minimizes scarring and accelerates healing times. RNFAs need extensive training to become proficient with procedural equipment. The training programs and increased demand for RNFAs present the last topic of discussion. The complete path of an RNFA demands academic accomplishment, extensive practical education, and focused medical education. Healthcare facilities need RNFAs because the number of surgical procedures continues to increase. So, before becoming an RNFA, a nurse needs to possess an RN license, which is the BSN, and secure perioperative experience, followed by finishing an accredited RNFA training program that combines classroom lessons with clinical practice training. The NASC, the National Assistant at Surgery Certification, is a mandatory qualification for RNFAs because most healthcare organizations seek this certification to enhance their job. RNFAs maintain high job demand across the market due to an elderly population and rising surgical operations. And this is per the Association of Perioperative Registered Nurses, Julia article of 2024. RNFAs with specialized skills find active recruitment from hospitals that need surgical support staff. Florence Nightingale once said that nursing is an art, and if it is to be made an art, it requires an exclusive devotion as hard as preparation as any painter's or sculptor's work. The surgical team depends on RNFAs, guaranteeing effective procedures and enhanced patient care results. So, we have finished inspecting the RNFA role, their equipment, and required training. So, let us summarize everything that we have learned. We investigated how our registered nurse first assistants function as fundamental team members in surgical operations, and we also elaborate the critical role of registered nurses in surgical teams. We analyzed the assortment of medical equipment through RNFAs to help surgeons operate efficiently. In the first section, analyzed the necessity of surgical assistants and their essential functions in the operating room environments. The last phase of our research analyzes the RNFA's training requirements and job market trends since they attract more professionals due to increased demand. Medical operations are critical situations